All right, welcome. Okay, we're here to do a thyroid lecture tonight. All right, so if you're not here to hear about thyroid, then you're in the wrong place. Okay? So, a couple things before we begin. Number one, small group. I should be able to answer all the questions as long as we don't get too carried away. Okay? Second, keep an open mind. Now, usually when people come out to hear me talk, it's usually not a problem for people to keep an open mind, right? I mean, usually people have nothing to do when it's 25 degrees out and on a Wednesday night. Stay home, watch television. So usually people are looking for some type of different types of solutions to their health. So again, usually keep an open mind is not a problem. But again, some of the things I'm going to talk about tonight may or may not jive with your belief systems and what you know. So I ask you to suspend belief here for this lecture. Don't take yourself off your medications. Don't say, Dr. White told me to take myself off my medications. I didn't say to do that. Okay? And most importantly, if you can check your cell phone. I know everybody checked it, but if you can, everybody's off? Yes? She's smiling. Okay. All right, so again, please, no picture and video recordings. Sometimes it breaks my concentration. So, goals for the workshop. What are we here to discuss tonight? Number one, what is hypothyroidism? Okay. Number two, how's it diagnosed? Number three, in 90% of the cases, what really is hypothyroidism, because it's not a thyroid condition at all. And number four, some management strategies. So we got a lot of stuff to go through here tonight. We got to be out of here by about, I think, 8:45, so I'm going to do my best to move things along and leave some time for questions at the end. Belief systems. Everybody has them. The reason I put the slide in here is a number of, I don't know, maybe a year ago, I was doing a talk, a diabetes talk, and a person came up to me, actually it was a woman, and she was in the audience, and she was quite upset because she thought I was personally attacking her medical doctor. All right? Now, I'm here to express, tonight I'm here to express an opinion. I think it's the right opinion, but it's an opinion. And sometimes when you say things that people don't necessarily, their belief systems are incongruent with, sometimes people can be upset. So again, I'm not here to upset anybody tonight, I'm just here to share information. Okay? Who am I and what qualifies me to speak on hypothyroidism? My name is Dr. Robert White and I'm a chiropractor. Now, people say chiropractor? What does a chiropractor have to do with thyroid, right? It's not a spine condition. Well, here's my story. About 6 years ago, my mother was diagnosed as being diabetic. She was pre-diabetic. She was really diabetic. And she came to me and she said, what are we going to do about this? And I said, I don't have any idea. Right? I do spines. I don't do diabetes. She said, no. You have to help me. So, through me helping her, I get introduced to a field called functional medicine. Anybody ever hear of a field called functional medicine? Nobody? Okay. Functional medicine deals with the causes of disease and prevention, not treating symptoms. Right? Because most of the models that people are in now when it comes to healthcare has little or nothing to do with the cause of disease. It's about managing the symptoms of disease as you get worse. Would you agree with me on that one? Right? So, for me helping her, I get introduced to functional medicine, and really is now the focus of my practice. Now, chiropractic and functional medicine work very well together, but they're two separate things. Okay? So, that's how I get introduced to managing thyroid and a whole bunch of other conditions. Now, who in here thinks the healthcare system in America is just perfect? Anybody? Who in here thinks we got big problems? Big problems. Okay? I'll get a quick little video that'll explain this.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, probably get paid $1,500. For me to spend 45 minutes with the patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems societies have.
Soldiers' use of prescription drugs has tripled in the past 5 years.
The medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that established the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future. Not just the health of healthcare, it's not the health of the nation.
Now, if you want to watch the rest of that movie, obviously you can go to Escape Fire Movie online and watch the whole thing. Basically, the reason is that we are in such a crisis in America is because we don't have, like they said, we don't have a healthcare system at all. We have a disease management system, right? Other than crisis care, let's say you have a heart attack or other stroke or something like that, most of the things that masquerades as healthcare is nothing but smoke and mirrors. Who in here has seen Wizard of Oz? Anybody? Remember? At the end they pulled the curtain back, the little guy back there? Everybody thought it was this great, huge, all-powerful thing. It ended up being something completely different. And that's sort of the analogy I use when it comes to the American healthcare system. The system that most people rely on to bail them out when there's a crisis, there's a lot of smoke and mirrors, especially when it comes to long-term healthcare. Okay? Guess who's got to be in charge of your health? You guys, right? Not me. Okay? You need to take charge. Now listen, 10 years ago or 15 years ago, it was hard. Right? If you wanted any information, you had to go to where? You had to go to the library, you had to go to a doctor's office, it was a hospital maybe. Access to information was really hard. Today, it's easy, right? You sit in your pajamas and go on the internet and you can find out anything you want to know. So the only reason you aren't up on what's going on is because what? Because you're lazy. Right? You need to be in charge of your health. If you're given something, you better know the consequences of taking it. Just don't take somebody's word for it. Don't take my word for it. Don't take your medical doctor's word for it. I want you to do your homework. Because whose health is at stake? Yours. Okay? Right now, 85% of all medical procedures and surgeries are scientifically unproven. 90% of all diseases prevalent today are not treatable with orthodox medical practices, orthodox medical procedures. Right? And yet this is the system that everybody believes is this great thing that's going to save them. You know, we talk about health. Everybody says, oh, what's your greatest asset? Your health is your greatest asset. Now, who in here believes that? Sort of cliche, right? But who believes that? The truth is, without your health, you can't have anything. I mean, you can't have a career, you can't have relationships, you can't have family, goals, hobbies, anything you want to do, you can't do unless you have good health. Now, we're going to see how important your health is to you. Now, what I want to do is, I want everybody to think of a food they like a lot that they eat often. You don't have to tell me, but think of one. Got one? Could be anything. Yes? 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 Yes. Okay. Now, if I said, listen, your health is at stake, you want to get better, You got to give up that food for 6 months or a year, 100%. Who could do it?
Even if it's fruit?
It's irrelevant what it is. Okay? Just trying to see where your head's at. Okay? One person? Can't do it?
I can, but I think there's nothing wrong I eat, so I actually eat the healthy.
Right, well, it doesn't matter. It doesn't matter what the food is. I'm just saying, listen, Albert Einstein said the definition of insanity was doing the same thing over and over in the same way, expecting a different result. Okay? If you're living your life in a way that's contributing to chronic disease, and you're not willing to change it, you want health to return, you're insane. So when I ask that question, it's not, listen, I'm not saying you have to give up anything, but what I'm saying is, if you had to get better, could you?
Oh yeah, sure.
Huh? Reluctant.
No, it was very hard to respond because on daily basis, like you intend to do it, but you can't.
Well, I'm just trying to see where your head is at. Because listen, there's a lot of people who want health, but when you say, you know what, by the way, you have to make changes X, Y, and Z, they say, nope, not interested. Okay? No miracles, okay? You have to do some work. But if you're not willing to change, listen, if you have a blood sugar problem and you're not willing to give up sweets, and you want your blood sugar problem to go away, you're insane. It's just not going to work. So that's why I asked that question. So I'm going to ask you as we go through the rest of this program, how important is your health? Because usually when I do this, there's always a few skeptics that say, no way. Okay, there's no way I could do it. And I flatly tell them, listen, you should probably save yourself the time and leave the room now. And they look at me funny, what do you mean by that? Because again, medicine, basically you go, you get diagnosed, and you take medication, and we'll see you in 3 months. When it comes to restoring health, you have to be active participants in your health care. Not everybody wants to do that. Okay? Well, when we talk about health, what really is health? Okay? So, if I asked you, how do you know you're healthy? What would you say?
How I know I'm healthy? Personally, my mental health affects my body.
Okay. So you're saying if you're clear mentally, then you think you're healthy?
Yeah.
Okay. Anybody else have any other answers?
My body responds.
Okay, so it's how you feel?
Yes.
Okay, so how you feel. Everybody agree with that? That's how most people think their health is? What would you say?
You know, you go for physical.
All right, so you base it on testing.
Yeah. I push
whatever you feel, you know, like you wake up every day and, you know, like you feel happy, everything is, you know, is okay with you, so you don't have to.
So most people would say how they feel is how their state of health overall. Not everybody, but most people. Do you agree with that? If you wake up, you feel good, you're happy, most people would say, yeah, things are pretty good.
Okay? You get headaches, I know something's wrong.
Right, so again, it's how you feel. All right, so I'm going to give you an example. Let's say tonight after this lecture, you say, man, that guy was unbelievable. I learned so much. And there's an Irish pub right over here on Morris Avenue. Okay? You say, you know what, I'm going in there and I'm going to celebrate. I'm going to have some cocktails. And you have 2 bottles of wine. How are you going to feel? Take a cab home, of course. How are you going to feel tomorrow? Terrible. Right? Are you sick?
Because it comes from here. Whatever you put in here, it's going to affect here, go here,
Right.
and give the order.
But are you sick if you had that much wine?
I don't know.
Huh?
Yes, so I never had it.
Okay, but I'm saying is, the answer is no, you're toxic, okay, from all the alcohol. Now, right now, Guyton's textbook of medical physiology, okay, says, with the most advanced testing we have in the world today, guess how long you've had cancer by the first time they can detect it. Guess how long you've had it.
Like 40 years?
It's about 7 years, okay? So here's an example where you feel lousy, but you're healthy because you have too much to drink. Another example is I have a pathological disease that unless it's taken care of can potentially kill me, but I feel fine. So I like to rephrase what health really is. It's not how you feel, but how you're functioning. Right? How well is your body working? Because sometimes you can be working just fine, okay, like drinking all that alcohol, and your liver will detoxify you, and you wake up the next day and you feel okay. You're back to being happy. Or another time you can feel lousy from the wine, but you're actually healthy, or you can actually feel great and be very, very sick. So we're going to use function, how your body is working, as our benchmark for what health really is. Okay? So now that we got that out of the way, let's talk about thyroid specifically. How does it work? Your hypothalamus, which is part of your brain, sends information to your pituitary gland, and that's a little pea-sized gland in the base of your brain, right about here. And that pituitary releases a hormone called thyroid-stimulating hormone. Everybody hear that one? Okay, if you've been diagnosed with thyroid, you're well versed with that one. Thyroid-stimulating hormone stimulates the thyroid to make T4, which is inactive thyroid, and T3, which is active thyroid. Okay? Brain tells the thyroid to work, the thyroid makes thyroid hormone. Now, when the thyroid makes hormone, 93% of what comes out is inactive thyroid. Okay? It's not ready to work. 7% that comes out, again, these are approximate numbers, but 7% that comes out is active and ready to go. Okay? Now, this inactive thyroid or off needs to be done what? Needs to be turned to active or on. So, 60% of this comes down to your liver and gets turned from off to on. Okay? 20% comes down to your digestive tract and gets turned from off to on. And the remaining 20% is called reverse T3. It's like a safety valve. Anybody know anybody who's ever had Graves' disease? Okay, that's hyperthyroidism. That's too much thyroid hormone. Okay, heart palpitations, sweating, can be life-threatening at times. So, let's see how well you guys were thinking tonight. Is it possible to have a liver issue that mimics a thyroid condition? Yes? No? I'm seeing, well, you don't know, 3 yeses. The answer is yes. Because remember, 60% of the hormone that's inactive or off that needs to be turned on gets converted in your liver. Okay? So if your liver's malfunctioning, okay, you're not going to be able to make enough thyroid hormone. Is it possible to have a digestive tract issue that mimics a thyroid issue?
Yes.
Yes, the answer is yes. Now, unfortunately, how many times do people go to their healthcare practitioner and they look at liver function and digestive function and correlate it to thyroid function? Almost never. Never, right? And I agree with you. Yet it's an integral part. It's not as simple as elevated TSH, here's some Synthroid, okay? If you want to fix the problem, you need to understand what exactly is happening. Maybe it's not a thyroid condition at all. Okay? Maybe it's a liver issue or a gut issue, or maybe it's something different, which we're going to talk about as we go along here. So again, it's not as simple as just take hormone and everything will be fine. Okay? So, why is thyroid important? It does a whole bunch of things. It does bone metabolism, gut function, and reproduction, and gallbladder and liver, and fat burning, weight loss, and sugar metabolism, and cholesterol metabolism, and brain chemistry, and more hormones, and adrenal glands, and liver, and stomach, and protein, and heat and hot flashes, and more hormones, and anemia and heart. Now, that's just a few. Right? Every single cell in the body has thyroid receptors on it. Your brain, your spine, muscles, everything, organs, everything. So it's sort of an important hormone. So if you don't have enough of it, your health is going to suffer. I can make this list 20 times as long. So this is what it does. And when it doesn't work, right, we get symptoms. Now, what is the number one complaint, the number one symptom that people come in is for what? Tired. Okay, you're tired.
Weight gain.
Everybody's got to lose weight. Okay? Number one by far, in my experience.
Sometimes thyroids, they make you lose weight. It's thyroids that make you lose weight.
Make you lose weight? That's hyperthyroid.
Yeah.
Okay. So number one complaint I hear is, I got to lose weight. Number two, my hair is falling out. Okay? Those are the top two. Now we're going to talk about some other ones here. I'm tired and sluggish. Okay, another thyroid symptom. Can't go to the bathroom. I'm depressed. Now I always say we should maybe bring your spouse or significant other in here and we'll let him answer some of these questions. Okay, are you depressed? Headaches in the morning maybe? Okay, cold hands and cold feet?
Yes.
All right, hot flashes. Yeah. This is a hyper type symptom, but we're going to talk about how it correlates. Okay, again, thyroid issue. Mood swings, again, ask your spouse, are you moody? No? Nobody in here is moody, right?
No.
Nervous and emotional, again. Can't sleep at night. This is a hyper type symptom. Okay? Sweating at night. Okay, again, this is a hyper type symptom. All right, so those are just some of the symptoms when your thyroid is not working right. So how is hypothyroidism diagnosed? Right? So listen, you're living your life, things start to go wrong. You go to your medical doctor, maybe a month, 6 months, years, whatever it is, he does a blood test and he says, you are hypothyroid. Right? Now, in order to be diagnosed hypothyroid, you only need one marker. And that's thyroid stimulating hormone, TSH. And everybody's familiar with that one, right? It's done by a blood test. And as long as you're outside this range, and this is a patient, 0.45 to 4.5, as long as you're outside that range, you're considered hypothyroid. Now look at this person here. What does that say?
81.
Think she got problems? Big problems. Okay. She's also almost a diabetic too. Okay. So the moment after you've been diagnosed, what happens? Well, what happens? What comes out the moment after you've been diagnosed?
Pills.
Right, prescription pad. Okay?
Drugs.
Right, we're going to start you on a low dose. Everybody's on a low dose. See, my definition of a low dose is 0. That's my definition of a low dose. But everybody's on a low dose. We'll start you on a low dose. I don't know, we'll start you on 50 micrograms or something like that. And then we'll see you in a couple months and we'll see how you're doing. Is that about right in terms of the game plan here?
Yes, yes, I do.
So we'll do some more blood tests after 3 months, and if you're doing okay, we'll leave it alone. But let's say you're not doing okay. Let's say you're still tired. Let's say you can't go to the bathroom. Let's say you can't lose weight. You don't have good energy. Well, you know what? Maybe we'll try a little more. Or we'll try something different. Or we'll try 2. Okay? Sort of trial and error. Okay? And that's all part of the disease we're going to talk a little bit about. Until we try and get your hormones balanced. See, medicine, unfortunately, a while ago, they used to treat the whole person. Then they narrowed it down and they used to treat the symptom. And now they manipulate your physiology based on labs due to medication. So you go in and you get your hormones, you get your thyroid balanced, but you still feel lousy. Doctor may say, you know what? Maybe it's in your, where? It's in your head. Why don't we try an antidepressant? You know my patients come in on antidepressants? Because they've been over and over and over this, and even though their labs say their hormones are balanced, they still feel lousy. Maybe it's a mental problem. Okay? So this is how hypothyroid is diagnosed. Off this one marker. Okay? But did you know the model of taking replacement is based on a 50-year-old model of care? Now, what does that mean? Anytime you give the body anything, it stops making it on its own. Right? Weightlifters who take testosterone to make their muscles big, their ability to produce testosterone on their own shuts off or slows down. And the body's lazy. It says, listen, if you're giving it to me, why should I go through all the trouble of making it on my own? Right? And if you're also giving it, it actually, like I said, it shuts down the body's ability to produce it on its own. So if you shut off the factory that's making it, guess what happens over time to your ability to produce it? Shuts off, right? Then you become more and more dependent on the medication. That's the model. It's not a very good model, is it? Okay. You ever ask yourself, this is good book, okay? Why do I still have thyroid symptoms when my lab tests are normal? Again, because it's not about addressing the cause, it's about manipulating your labs with pharmaceuticals until they fall within the reference ranges, yet the underlying cause of what's really going on in most cases is left completely unaddressed. You know how many people come in and say that? My labs are fine, but I got this, and this. Okay? Because the cause is not being addressed. Right? So, you already know the answer to this one. In most cases, what really is hypothyroidism? Okay? In most cases, it's Hashimoto's. Now, who in here knows what Hashimoto's is? Anybody?
I have it, but like you want the definition of it?
Yeah, I mean, do you know what it actually is?
My thyroid is not it's not making enough of the
enough hormone.
Yeah, the good one.
Right, so here's really what it is. Veronica, all right. Here's what happens in most cases, okay? Hashimoto's thyroiditis is an autoimmune disease that is attacking your thyroid. So what does that mean? Your body has a defense system, okay? It's cold and flu season out now. A lot of people are getting sick, right? The only reason everybody's not dropping dead is your body has a defense system. So that bacteria, that virus gets in there, your immune system's supposed to come and what? Kill it so you can stay healthy. Now, when your body loses the ability to differentiate between your tissue, your body, and the outside world, you say you have an autoimmune disease. What it chooses to attack is the name. So if your body says, you know what, pancreas, you're bad. We need to kill you. You can develop type 1 diabetes. Okay? Your body's attacking your pancreas to the point where your pancreas doesn't work and it can't make insulin. If your body says, you know what, joint cartilage, you're bad. You shouldn't be here. Your body starts attacking your joint cartilage, we say you have what? Rheumatoid arthritis. Okay? If your body says spine, myelin spine, the coverings of your spine, you're bad, and starts attacking that, we say you have multiple sclerosis, MS. Or, if your body says, you know what, thyroid, you're bad, you shouldn't be here, starts attacking your thyroid, we say you have Hashimoto's. Yeah. So the issue is, clinical research says 90% of the time, people who've been diagnosed with hypothyroid don't have a thyroid condition at all. They have an autoimmune disease which is attacking their thyroid. Yeah. But, let me ask you this. Is the autoimmune component ever addressed in medicine? No. What they do is they let the thyroid be destroyed by your immune system, and then they give you medication to supplement the fact that the thyroid's been destroyed. I'll tell you a story about this in a second. So, who in here thinks hypothyroidism is reversible? Or hopes it is?
By eating right, I guess you can reverse whatever is, attacking you.
Okay. I'll let somebody tell you about that right now, okay?
One of them. All right, so how long have you been here?
Since August of 2013.
Yeah, so about what, 9 months? Okay, and you came here originally for what?
For the weight loss program.
Okay. But we also found out you have a few other things going on, right?
Yes.
All right. Now, a little bit about your history. You had some health issues that caused you to what? Not be able to. What's your story?
I wasn't able to move. I was stiff. My joints felt stiff. I was always swollen. I had abdominal pain, pain in my lower back, cramping, migraines. I just felt overall crappy.
I can understand that. And then, so what did you do prior to coming here to try and find out what was wrong with you? What doctors did you see? I know you're gonna laugh. This one we did.
I was actually at the doctor's, I could say, every week. I would go to my general doctor. I went to my gynecologist because the pain was lower back and abdominal. I thought maybe I had, an infection. I went for MRIs, I went for x-rays, I just went for every test possible, blood work, pretty much every month. They never found anything. They finally sent me to New York, to the cancer hospital.
Okay.
I had x-rays done there. They found some sort of mass, so I had to get that biopsy. And that turned out to be nothing. So it was always just, they weren't able to tell me what was wrong with me. So.
And you came here and we found out you have what?
Hashimoto's.
Hashimoto's, a miracle, right?
Yeah.
So, tell what's changed in the last 9 months since you've been here. How things have changed, better, worse, whatever.
I feel great. I have more energy. I sleep better. I'm regular.
Aches and pains?
Aches and pains are gone.
Are you going back to work?
I would like to. So
you actually had to leave work because of this, right?
I actually got fired from
Okay.
work
Right.
because I was always sick and the doctors would tell me to stay home. I would always have doctor's notes, but they couldn't tell me what was wrong with me, so I couldn't go on disability without them being able to diagnose me with anything. So I finally got fired from that. So, but it was a blessing in disguise, because I found you guys.
That's true. So I mean, great, and everybody likes to hear this. So how much weight have you lost?
I think we're about 35 pounds.
Right. And before coming here, trouble losing weight?
Oh my God, I couldn't lose weight. Actually, I had my daughter. I was 205 pounds when I delivered my daughter. When I delivered her, I went down to 200, and when I went for my first doctor's appointment, I was still at 200. He was like, "Why aren't you able to lose the weight?"
Right.
I wasn't eating. I was trying to eat healthy.
Right.
And he was like, "There's something wrong. There has to be something wrong."
Yeah,
and
you're
couldn't figure it out.
Right.
Exactly. Yeah,
There it is.
I wasn't losing the weight, and I felt awful. I felt disgusting.
No, but you're doing fantastic. I mean, I can't, but you get the credit. Except for, well, you get the credit most of the time. Except when you do what you're not supposed to do, right?
Yes, exactly. And I feel it. I pay for it.
That's true. And that's sort of a good clinical thing, because sometimes people, it shows them that they have to be compliant, otherwise things aren't going to work out like they should.
Yes, exactly.
Okay. Thanks.
All right, so listen, I show you that video not to impress you, but to impress upon you what's possible when you deal with the causes of the situation. And this is one of my greatest success stories. Okay, Veronica, she came to us, she was almost 400 pounds. Okay, and things were going up and up and up and up and up and up and up. And we worked with her, and here she is 16 months later. She had lost about 150 pounds, more than that. I haven't talked to her in a while, but I'm sure she's doing better. Okay? So again, she was totally transformed. Again, before she came to see us, again, so when you deal with the cause of a situation, amazing things are possible. Now here is the issue. Everybody likes to see is that, if I work, if I eat well, if I do everything I need to do, at some point is this going to go away? Right? Everybody wants to know that. And the answer is, unfortunately, there's no cure. Okay? Autoimmunity is genetic in nature. That means you went through a stressful event, and I'll talk about that in a second, and at some point your body changed, and now genetically you are different than you were before. Unfortunately, it's like a light switch. You turn the switch on, there is no going back. Okay? This is going to be something you're going to be dealing with or managing for the rest of your life. Or not managing. That choice is yours, right? How important is your what? Health. So this is going to be something you're going to be managing for the rest of your life. Doesn't mean it can't be a great life. Okay? Doesn't mean you can't have transformative health changes. But ultimately it means at the end of the day, it's always going to be there. So if you go back, definition of insanity, doing the same things over and over in the same way, if you start to do the things that make you sick, guess what will happen? You'll go right back into it. And listen, believe it or not, I went through just came through the worst time. The holidays were the worst time of the year for me. Right? Because everybody does what? Drinks and parties and does all this other stuff. So you come through January and the office empties out, and nobody's in there, and January 2nd, the office fills back up, and I'm like Humpty Dumpty trying to put them back together again. Because everybody's all flared up, they can't go to the bathroom, they gained a bunch of weight, they can't sleep, whatever it is. Because their immune systems went crazy, because they stimulated their immune systems for the holiday, and now they have this systemic attack that's going on. Okay? So unfortunately, there is no cure. There's only management for the rest of your life. Right? So here's some statistics on Hashimoto's. 90% are actually autoimmune. 90% of hypothyroid is actually Hashimoto's. It's the most common autoimmune disease in America right now. 7 to 8% of the population has been diagnosed. They've been to their medical doctor, they've had a test done, they've been diagnosed as being hypothyroid. It's a 24-to-1 woman to men disease. Now, women, obviously, their immune system's a lot different. They have to, carry children for 9 months. So ultimately, at the end of the day, it's sort of a double-edged sword. The immune system is better and it's worse because they have to be more sensitive to be able to carry children. But in the end, sometimes that system can break down. It affects about 30 million people in America. This is the thing as a clinician, the thing that bothers me the most. Right now, 50%, I think it's closer to 80, but clinical research says 50% of the people who have one autoimmune disease, and if you've been diagnosed as hypothyroid, you have a 90% chance that you are autoimmune. You have multiple autoimmune diseases going on in your body at the same time. Now, there's actually testing. There's a lab out of Arizona called Thyroid Labs. They actually do a 26-tissue antibody test. They can actually look at all these different tissues in your body, and you can actually see all these immune processes going on. Right? And sometimes we run this test just to show patients, hey, listen, you're going to attack against your pancreas. When do you want to start dealing with this? Now or when you're an insulin-dependent diabetic? Your choice, right? Or you have an attack against the myelin in your spinal cord. When do you want to start dealing with this? Now or when you have a foot drop? See, how important is your health? Are you willing to make the changes necessary to slow or stop the immune attack, to postpone or avoid possible consequences in the future? And this is the thing that's another disturbing. Right now it's estimated that 240 million people, about 3/4 of America, actually have subclinical autoimmune processes going on in their body right now. What does that mean? They have these subclinical autoimmune destruction of their body, but it hasn't gotten bad enough yet where it'll be picked up in medicine. Right? Diabetes, blood sugar, most of the time in medicine isn't picked up until you become, well, maybe looked at, but it's really not dealt with until when? Until you become a diabetic. That's what's going on. You have all these subclinical, body's eating itself, but it hasn't gotten bad enough yet where it actually be picked up. Or people start to experience symptoms of these autoimmune diseases. Right? So how does autoimmune happen? Right? Obviously, most people here are thyroid patients, but how does this whole situation happen? Okay? Now, regardless of the name, what happens is it needs a trigger to turn on. Now, for women, okay, the big triggers are puberty, childbirth, menopause. Those are the three big ones. So, I just actually had a patient, a consultation earlier today. She wasn't hypothyroid, she just had a baby, now she is. It's a stressful event that your body goes through where your body can't handle the stress properly, and genetically you change, and now your body starts eating itself. Okay? So it needs a trigger. Now there's other triggers. Another one could be physical trauma. Let's say you got into a car accident. Okay? Or it can be an infection or sickness. Let's say you had pneumonia. Or it can be a toxic load, exposed to some type of chemicals or something like that. Or, I see this one a lot, emotional trauma. I went through a nasty divorce, death of a spouse, death of a child. Or maybe it's a combination. Maybe I had my second child and then I got sick. Or maybe I got sick and then I went through a divorce. I don't know, whatever it is. At some point the immune system becomes overwhelmed and you change. And now you eat yourself. And like I said, once it's on, it's on. So what does this actually look like? Okay? Now, here's my famous graphics that I did. So listen, this is your immune system, right? And this is your thyroid. And this is what sort of happens. See, your immune system starts eating. Okay? Now, in order for you to be diagnosed hypothyroid, it's estimated that at least half to 2/3 of the gland needs to be destroyed. So initially, when this eating begins, you feel fine. Because there's still 3/4 or 7/8 of the gland here that still can make enough hormone for you guys to feel healthy and function the way you're supposed to. But as time goes on, more and more of the gland gets destroyed until at this point, there's not very much of the gland left, right? And what does your brain do? Brain says, okay, little bit of gland that's left, you have to do the job, you have to do the job of the entire thyroid. So you have to work overtime. And what does your brain do? Your brain raises TSH to make the little bit that's left work extra hard. Make sense? Okay? I had a patient, okay? She, about 8 years ago, she went to a medical doctor. For some reason, they ran the test to find out whether she was autoimmune or not. And they found out that she was. But there's nothing they can do for it, so they just monitored her. And for 8 years, they watched as her thyroid TSH, thyroid stimulating hormone, slowly went up and up and up until it crossed that barrier. Remember the blood test, 4.5? Until it crossed that barrier, and they say, now we can help you. And the help was Thyroid. So for 8 years, they knew she had it. They did nothing until enough of the thyroid was destroyed that they'd say, now we can help you. Listen, that's like you go to the dentist and he does his exam. He says, you know what, you got a cavity. Does it hurt? Nope. We're going to leave it alone. Okay? And we're going to monitor you as the cavity gets bigger and bigger and bigger. So let's say you wait a couple of years and finally you go back to the dentist and he says, you know what? Doc, my tooth is killing me. All right, we're not going to fix the problem. We're going to give you some aspirin to dull the pain. Now, anybody who's managed that way in dentistry would find a new dentist in 2 seconds, right? But that's the way you're being managed in medicine with your thyroid. The destruction happens, the thyroid gets destroyed. Instead of dealing with the problem, which is the immune attack, it's left completely alone until enough of the thyroid is destroyed that they say, you know what, we're going to give you hormone to supplement the fact is the thyroid's not working right. Doesn't make any sense, does it? Doesn't make any sense at all. But that's the way people are managed. Okay, so listen, whatever the name is, the immune system attack is a name. So if your pancreas is getting attacked, we call it diabetes, type 1 diabetes. Your spinal cord, we call it MS. Brain, Parkinson's, Alzheimer's, dementia, all have autoimmune components to it. Okay, your intestines, Crohn's, IBS, joints, rheumatoid arthritis, endometriosis would be your uterus, okay? Stomach, pernicious anemia, B12 absorption, spine, osteoporosis. Now listen, if you want to go down and look, just go online and Google autoimmune diseases and you can get the whole list, okay? Listen, I had a mentor of mine who says that the next epidemic over the next decade is going to be autoimmunity. Think about it. 3/4 of America has subclinical autoimmune processes now. They just haven't manifested yet. Now listen, when I was growing up, okay, lifestyle, I don't have any children, but I used to what? Go out, run around all day. My mother used to ring the cowbell for me to come home, right? A lot of exercise. We used to have dinner at the, real food at dinner time. Today, most kids' lifestyle is very different. Right? There's little or no physical activity. It's mostly about texting and video games and all these other things. Okay? A lot of times it's prepared foods or something like that because everybody's so busy. It's a very different lifestyle than it was a generation ago. And unfortunately, people's immune systems just can't handle it. It's not the way it's supposed to be. So, there's 3 stages of autoimmunity. Number 1 is silent autoimmunity. Now, what does that mean? Remember that picture of the thyroid? Your body makes these things called antibodies. And antibodies are proteins. They're markers that your body puts on bad things. Like the AIDS virus. When they test for the AIDS virus, the virus is too small. They can't see it. So what do? They see, were you exposed to the AIDS virus? And how do they know that? They check for the antibodies to the AIDS virus. When your body encounters a threat, it makes these markers, simplifying this, makes these markers that put X's on things that are bad. And depending on what it is, certain sections of the immune system can make and destroy it. Now, I'm being sort of simplified there. So what happens is, once your body decides that you're going to have your body's going to start destroying your thyroid, your body makes antibodies to your thyroid. Okay? Thyroid, you're bad. We're going to start destroying it. It starts marking your thyroid as being bad, and the immune system comes in and destroys it. So the first stage of autoimmunity is elevated antibodies. Maybe there's one chunk out of the thyroid in that picture. Elevated antibodies, but no loss of function. Right? Unfortunately, when we do blood chemistry on patients, we check for autoimmunity in every person who comes in because it's so prevalent. And you know how many people we find in silent autoimmunity? Where the body's chewing, but it hasn't gotten bad enough yet? A lot. A couple a week, usually. Okay? So they have the disease. Again, they feel fine, but they don't even know it. Okay? So if you leave this long enough, this turns into stage 2. Now, stage 2 is elevated antibodies with symptoms and no loss of function, but no severe destruction of tissue associated with disease. This is where most people start to complain, you know what, I just can't lose weight. Okay, there's loss of function. But there's still enough of that gland, remember that picture? That TSH does not need to be elevated. So it's missed in medicine. So you start to experience the symptoms of problems, but it hasn't gotten bad enough yet where the brain has to raise TSH high enough where it can be picked up in medicine. Okay? So if you leave this long enough, it turns into what? Where everybody goes to the doctor. Okay? Elevated antibodies, significant symptoms, labs, signs, imaging, and special studies associated with significant loss of function. This is where it's like, you know what? You're hypothyroid. Let's give you some hormone. So my question to you is, when would you want to know? Here or there? Here, right? Or maybe even before, do everything you can so it doesn't even turn on. But let's say it's on. The time to figure out would be here, because if you can figure out here, a lot of times you can slow or stop the immune response so you can delay a person going on medication maybe for years or potentially decades. But it's never checked here. Because, listen, if you're a plumber and you have a pipe, you need what? A wrench. Right? If you're a carpenter and you have a hammer, you have a nail, you need a what? Hammer. In medicine, in order to manage anything, you need a drug and or therapy. But there is no drugs long-term for autoimmunity. So whether you have it or not, why bother checking for it? Because there's nothing we can do for it. So, they monitor it, they monitor it, they monitor it. Boom, it's bad enough, we'll give you something to make up for the fact that your thyroid can't produce hormone. But we're still not going to address the cause, which 90% of the time is the immune response destroying your thyroid. Makes you excited, right? Okay, so here's how your immune system works. Your immune system's like a seesaw. Okay? Remember the Pac-Man over the other picture there? There's the attack side, and there's the side that sort of calms it down. What happens is autoimmunity, the attack side is always on. Meaning that your body's always attacking, attacking, attacking. See, the problem isn't getting sick. Like, let's say you get a cold, okay? 10 days, 2 weeks, whatever it is, you feel lousy, you got a fever, headache, you're in bed a few days. The problem isn't getting sick. The problem isn't coming to resolution, right? You get sick, it's an inconvenience, you take off from work, but then you feel better 2 weeks and things are back to normal. Imagine if you got sick and you never got better. You had that cold forever. That's what this is, okay? Your immune system's out of balance and it's continually attacking, and every time it attacks, you lose tissue. Thyroid tissue or other things. So the condition continues to get worse and worse and worse, okay? See, the medical model most people are in, and the analogy I always use in my office is, you're a car and you're heading towards a cliff, right? This cliff is chronic disease, and it can be anything. It can be high blood pressure, it can be high cholesterol, it can be high blood sugar, whatever thyroid issues. And you're monitored as you head towards the cliff. So you go for your yearly physical, right? And they say, you know what, your blood sugar's up a little bit, you better get some exercise and cut down on the sweets. Or your blood pressure's up a little bit, you better lay off the salt. It's not until you go over the cliff that arbitrary line that says, now you're sick, and they say, now we can help you. And the help most of the time is what? Medication. Now, necessary for life at times, crisis situations. But again, does the help fix the problem most of the time? No. It manages the symptoms of poor health, makes you feel better, controls your blood sugar, controls your thyroid hormones without ever really addressing the cause. That's the model. This is the model most people are in. And it doesn't make a whole lot of sense. Albert Einstein said the definition of insanity. Remember I asked you at the beginning about if you were willing to make some lifestyle changes, if it meant, okay? If you're doing something that's contributing to your disease and you're not willing to change and you want health, you're insane. So let's talk about some answers, okay? Functional medicine. Now, I asked you at the beginning, but who in here, nobody's heard of functional medicine? Anybody ever hear of functional medicine before?
You just explained it.
Okay. But no, but anybody before tonight, has anybody heard of functional medicine before?
No.
Okay. Anybody here of Dr. Oz?
Yes.
Okay. Everybody's heard of Dr. Oz, right? I'll let him, it's about 3 minutes, I'll let him explain what functional medicine is.
I'm answering the #1 question I get asked no matter where I go. Which doctors would I send my family to? Now on this show, I'm revealing who they are and what they do. I call them the disease detectives because they're using new clues to prevent and to cure disease. They're my Fantastic Four, doctors on the cutting edge of medicine with a radical new understanding of why you're tired, why you're gaining weight, hooked on medications, and struggling through menopause. Could their new approach to healing be the answer that you have been waiting for? Find out now. My go-to team, a cutting-edge group of medical detectives who go beyond the symptoms to uncover the underlying causes of the illnesses you fear most. They are forerunners in a new field called functional medicine, which strives to reveal the root of your health issues by looking at your entire body and your environment.
I'm Dr. Mark Hyman, and I'm the founder and medical director of the Ultra Wellness Center in Massachusetts. Functional medicine is uber science. It's the new science of biology, the real understanding of how our bodies work, how they break down, and how to fix them. If I could prescribe any drug on the planet, it would be food because it works better, faster, and cheaper than any medication. Food is the most powerful medicine we have to treat chronic disease like diabetes.
I'm Dr. Wendy Warner. I'm a holistic gynecologist. Dr. Oz turns to me because I know that there's more to healing than drugs and surgery. When it comes to menopause, I see the full picture and get down to the root cause. I don't just treat the symptoms.
I'm Dr. David Perlmutter. I'm a neurologist, and I'm medical director of the Perlmutter Health Center in Naples, Florida. Dr. Oz sends patients to me so that I can empower them with the ability to not only prevent Alzheimer's, but to cure the disease. I can show you how you can heal your brain.
I am Dr. Susan Blum. I am the founder and director of Blum Center for Health in New York. It's very common for a doctor to tell you to eat better, manage your stress, and to find balance. But they never tell you how to do it. That's where I come in. I can help you get your energy back for good.
And today, this foursome reveals their healing secrets with you. Please welcome my Fantastic Four of medicine. Dr. Mark Hyman, Dr. Susan Blum, Dr. David Perlmutter, and Dr. Wendy Warner. Thank you very much for joining me today. I brought them all here to share a very special day with you about the things that we can really do. Now, this panel, this power panel, represents different specialties, but they are all linked with one common thing. They all practice functional medicine. So that's time. You come on down first. Let's talk about functional medicine. A lot of folks don't know what it is. They've never heard the term before. Please, folks, I want you to remember what this means from now on. Talk to us about how this is different from the traditional practice of medicine, where all of us got our training, but maybe need to move away from.
Yeah, it's a fundamentally new way of thinking about health and disease. You know, there's two ways of thinking. In conventional medicine, you're either sick or you're healthy.
The most you can think is, right? How you doing? I'm fine, or I'm sick.
Right. But in functional medicine, we don't think that way. We think about the continuum of health, from optimal health on one end, all the way from to hidden imbalances to full-blown disease. Like you go from optimal health to weight gain to high blood pressure, cholesterol, diabetes, and so forth. You know, what we want to do is all along the way, we want to intervene to deal with the root causes and reverse the process. You know, disease goes away as a side effect of getting healthy. Yeah, and we treat the whole system, not the symptoms. And food is our most powerful drug.
So take this idea right now. You mentioned a few things here. And let's talk about diabetes, which happens to be a place that you are a world expert, a real authority. Talk to me a little bit about how we have missed the boat in the traditional practice of medicine when we try to take care of diabetes.
So traditional docs think of obesity and diabetes as two separate problems. But it really should be called diabesity, which is the idea that obesity and diabetes are really the same disease. They're so interconnected, and they're the main drivers of heart attacks, strokes, cancer, dementia, and more. Now, conventional docs wait until you have diabetes. They don't treat you along the continuum. They give you medication. That's just wrong.
Okay. Now, listen, I honestly believe that functional medicine will be the standard in 10 or 15 years. Uh-oh. Check your cell phone.
I'm sorry, I smiled, but I was sure that I turned it down. Once I got in the library, I'm so sorry.
You should make people stand up. Okay? Now, I believe functional medicine will be the standard because the public is going to demand it. Okay? People are sick and tired of being sick and tired. They realize that the approach they're taking in most cases isn't working, especially with these long-term chronic things. They're looking for different answers. Okay? So, it's not that medicine's going to want to change. It's that people are going to demand different approaches, and more practitioners are going to go into this. So how do most people end up in this model? Number one, you're living your life, something happens, okay? Your health starts to decline. You're not feeling well, you're tired, you can't go to the bathroom, you can't think straight, you're gaining weight, whatever it is. So, most people, what they do is they do what? Go to the doctor. And the doctor runs some tests and maybe finds something and maybe he doesn't. Now, the difference, most people, when they start to feel lousy, till they get diagnosed, is usually a period of time. Right? If you think about it, when you first start to feel lousy, and the time you found out you had a thyroid condition, usually there's a period of time in there. And sometimes it can be a long time. Sometimes it can be years or maybe even decades before people finally figure it out. Okay? So by the time you figure it out, we get what? Diagnosis. Now, for a lot of people, this is liberating. Yes. Now we know what it is. Now we can what? Now we can treat it, because now we got a name, we can do something about it. And usually what happens is, there's a honeymoon period. Meaning that people start to feel better for a period of time, right? And then what happens? Stuff starts to decline again. Start messing around with medications. Health starts to deteriorate. Maybe it's different medications, different combinations, different strengths. And when people still doesn't work, people start to look into alternatives. That's usually the path that most people follow. Agreed? Okay. Now, like I said, this can be a relatively short period of time, or this can be long. Listen, some of my patients right now, autoimmune 20, 25 years, more maybe. How much destruction, how much damage is done to their thyroid after 25 years of eating? A lot, okay? Chances of them having to be on medication for the rest of their lives, almost guaranteed, because there's nothing left. Okay? So this is how most people end up here. See, when people come, most of the time when people enter the alternative, we're not the first stop here, right? We're the last stop on the trip. Okay? This is the last stop on the train. Unless we pick it up through blood chemistry. So the chances of a person having moderate to severe thyroid destruction by the time they enter the alternative realm, maybe the functional realm, is high. Instead of looking for it right away and saying, okay, listen, let's intervene and do something to save tissue, it's overlooked until the very end. Okay? So, when we look at diseases, the name, who in here has ever seen an iceberg? I've never seen one. National Geographic Channel maybe or something like that. But listen, you, huh?
The movie Titanic.
Yeah, exactly. There you go. You put an ice cube in a glass. Only 10% of the ice cube sticks out. 90% is below the water. Same thing with an iceberg. Okay? So when we look at diseases, the name, diabetes, autoimmunity, thyroid conditions, fibromyalgia, obesity, whatever the name is,
What is that?
it's just a non-descriptive pain syndrome. Okay? Whatever the disease is, that's just the symptom. This is just a small piece of it. If you want to fix the causes, you have to get to the 90% of the things that are below the surface, like inflammatory things and structural imbalances and hormonal imbalances and digestive issues and toxic chemicals and cellular dysfunction. That's just a few things. So it's not about what you can see or name. It's about all the things that are below the surface that are causing this condition. And most of the time with people, when it comes to health issues, the health issues coming from, if you want to fix the cause, is coming from somewhere else. Like thyroid. Okay? Most people with thyroid don't have a thyroid condition at all. They have an autoimmune disease. And what's driving the autoimmune disease? We're going to talk about that in a second. There's many things that are even further away from there. Okay? So listen, if you have symptoms, first you got to figure out which one do you have. Okay? You need proper testing. Number one, do you really have a thyroid condition? And some people do. About 10% of the people actually have a sluggish thyroid. Okay, it's not working right. Just slow. Or do you have a brain issue that's causing your thyroid to be slow? I don't know. Maybe. Right? Or do you have a conversion issue? Remember the liver-gut issue we talked about earlier? Okay, so do you have that one? I don't know. Do you have a thyroid-binding globulin elevation due to estrogens and birth control? I'd say 80% of the women who come to see me who are in their 20s and 30s are what? On birth control. And most of them have thyroid-like symptoms. Okay? Do you have this one? I don't know. You can see it on labs. Do you have thyroid resistance? Remember you take the thyroid medication, your body stops making its own? Or there's too much thyroid hormone, your body actually becomes resistant to that extra hormone? Do you have that? I don't know. Or are you autoimmune? See, it's not as simple as elevated TSH. Take this Synthroid. If you want to fix the cause. Which one of these do you have? You gotta put on your detective hat and look around. Okay? So, who in here has seen a blood test? Anybody? A few people. All right, so listen. This is what a blood test looks like. So we have the test that's done is on the left usually. This is actual patient line. The middle column is your score, right? And over here is called what's called a reference range. Now, this reference range is important because if your score is in the middle of that reference range, you are what?
Okay.
Okay. And if it's outside that reference range, you are sick. Now, ever wonder where that range comes from? Sort of an important number, right? You're basing your health on that range, but nobody ever, well, it's not true. Almost nobody ever thinks about where that range comes from. They say, oh, it's got to be some type of scientific study or something like that. Here's where this reference range comes from. Remember school, bell curve? Okay? A, B, C. Okay, few people got an A, more people got a C. B, more people got a C, less people got a D, fewer people got an F. Remember that? Okay? It's called standard deviations. It's a statistical analysis. So what they do is they do a statistical analysis of people who go to the lab. So who goes to the lab most of the time? Healthy people or sick people? Sick people, right? So what they're doing is they're doing statistical analysis of sick people's blood to try and determine health. Does that make sense?
Yeah, absolutely.
That makes sense?
I'm sorry.
It doesn't make sense.
It doesn't make sense,
Right.
but it is clear. This is what I.
Right.
Yeah.
What they should do is haul a bunch of 20-year-olds down there, right? Provided they haven't been out partying the night before. Say, listen, let's use healthy people and let's use the standard. This is the standard, okay? And compare people to that standard. Now, here's the crazy thing about this thing. There's no standardization. You can go to Quest on one side of the street and be well, and go to LabCorp on the other side of the street and be sick. Or you can go to LabCorp in New Jersey and be sick, and go to LabCorp in Delaware and be well. Or you can go to LabCorp here and be sick and go to Overlook Hospital, because they deal with some really sick people over there, and be well. The only thing that's sort of standardized is lipids, cholesterol, that type of thing. So there's all this misinformation. So you can never get, it's a moving target that's continually changing, and as the population gets sicker and sicker, those ranges get wider and wider. So what was developed is called a functional range. Now this basically was where we are as America about 20 years ago. It's a much tighter range, and what it allows you to do is see potential problems coming before they happen. Remember, the time to fix a blood sugar problem is not after you're diabetic. Right? You want to know that before. Remember, Dr. Hyman? You want to intervene all along the way? All right, so listen, let's look at a functional range. Remember TSH, okay, thyroid stimulating hormone? This is LabCorp right now. 0.45 to 4.5. So as long as you're in this range, you are what? Okay. Well, let's say you have 3.2. Medicine is going to say you're what? You're fine. Now, functional medicine, I say, uh-oh, better start looking around, something's going wrong. Because remember, we want to intervene before it gets to be a big deal. So, you want to know your future? Okay, everybody wants to know what's coming, like a crystal ball. You want to know your future? Get your blood tested. But instead of looking at the reference ranges, use a functional analysis to look at the results. Now, what do I mean by that? Okay, here's another patient. It's an actual patient. Okay. Now, this guy was a diabetic, but for the purposes, it's fine. Okay. So the red is outside the lab range. Okay, what medicine would say. The yellow is outside the functional range. So if you look at the red, glucose and A1C, he's got a blood sugar problem, and he's got a red blood cell problem. That's it. That's all that's going to be seen. Was that all that's up there? No. Okay? The guy's got a bunch of other stuff. He's got an electrolyte problem. He's got an adrenal problem. He's got a liver problem. The guy's anemic. He's got an active infection. Okay? He's got an iron issue. His cholesterol's too low, and he's got a thyroid problem. That's what I see. When do you want to know about this stuff? When it's small and easier to manage, or when it's a big deal? Your choice. Right? It's a little different story than pathological range. So let's talk about some solutions, okay? Now, I had a guy who was giving me a hard time, okay, a couple months back. And he goes, where do you get your information? I thought I was making this up, okay? Just pulling it out of thin air. So these are just some of the reference journals that this information has come from. Guaranteed, if you're having trouble sleeping, pick up one of these. I mean, first of all, you know, I can't understand half this stuff, okay? PubMed is actually searchable. If you want to go online, you can actually type in whatever condition you got, different keywords, and you can search away. Okay? So, how do you manage this whole situation? Right? We talked about what it is, how it starts, what it causes, but how do you manage it other than taking Synthroid? So, who in here has a pet? What do you got?
Cat.
Okay. Is it a nice cat?
Indoor cat.
What?
He's an indoor cat.
Is he a nice cat?
No.
Not a nice cat. Bad example. You have any pets?
Nice.
You have a pet?
She's just special.
No pets? We're going to have to use the cat. Okay? What's the cat's name?
Raja. Raja.
Braza?
Raja.
Roger.
Raja.
Roger. Okay. Okay, let's say Raja. For argument for the example here, let's say he's a nice cat. Okay? But let's say one day you come home and his personality's changed. Okay? Instead of being this lovable cat that you can pet and purrs, he's crazy. He's knocking stuff over. He's scratching. He's meowing. He's going crazy. Now, if this persisted long enough, you can't have a crazy cat running around the house. So what can you do? Maybe you can train him. Get the water bottle out and squirt him, maybe. Or if it got bad enough, maybe you give him a cat sedative to calm him down, something to calm him down. But see, that's a symptom-based approach. One day he was okay. The next day, he's crazy. Something happened in there, right? Law of cause and effect. So something changed. So if you can figure out what's changed and address that, then maybe he'll return to his old self. Okay? So what is that? Maybe a cat moved in across the street you don't know about, and he stares all day at that cat, and he looks at that cat, and by the time you come home, he's overstimulated, he's going crazy. Or maybe the kid next door got a set of drums you don't know about, and all day he's pounding on those drums, driving the cat crazy. So you can shut the blinds so the cat can't see the other cat, or pound on, or go next door and tell him to turn the drums down, then maybe the cat would return to his normal self, right? Excuse me. So that's what we do. That's how we modulate immune system function. Okay? So what are some of the things that cause the immune system to be hyperactive and want to attack? Number one, anemia patterns. Okay, now what does that mean? The problem with your red blood cells. All right, so anemia patterns. Most people have chronic disease have some type of red blood cell problem. Okay, now where's it coming from? Is it a dietary thing? Is it an iron deficiency? Is it an inflammatory thing? This, when you work with people, is the first thing that needs to be addressed, and it's probably the most important thing. Because if you can't move food and supplies to the cells and remove waste, nothing's going to heal properly. So this needs to be figured out and addressed, whatever it is, number one. Okay? Number two, blood sugar. At least 3/4 of the people come see me have blood sugar problems. What does that mean? You have blood sugar imbalances, and sometimes they can be subtle. It doesn't have to be full-blown diabetes before it's a blood sugar issue. Most people need to stabilize their blood sugar because blood sugar imbalances drive the immune system, like the cat, drive the immune system to be hyperactive when it doesn't want to be. Okay? So you need to fix your blood sugar. Number three. Key number three. You gotta balance your hormones. Now, everybody in here's hormones are perfect, right? No. Most aren't. Okay? Most people's hormones are significantly, if they have liver dysfunction, you're going to have hormonal imbalances. We do special testing. It's a salivary-based testing where we can look at periods of time in hormones, different parts of the body. You need to not diagnose, but you need to figure out what's going on with your hormones and fix those too. Okay? Number four, you got to fix vitamin deficiencies. Now, vitamin D, remember that immune axis? Okay, the seesaw? Remember Pac-Man was on one side and the king? Yeah. Your immune system's like a seesaw. Okay, it's supposed to go back and forth. The thing in the middle, that little fulcrum in the middle, in your immune system is called a T regulatory cell. Okay, helps balance your immune system. The thing that helps modulate that T regulatory cell with a balancing mechanism is vitamin D and glutathione. Now, how much vitamin D? I don't know. Everybody's different. You can do blood tests and check. I mean, anybody who wants to learn all about vitamin D, you can go on, there's a site called vitamindcouncil.org. Read all about this, all the peer-reviewed literature, everything. So, vitamin D and glutathione help balance your immune system. And like I said, vitamin D makes me look way smarter than I am in a lot of cases. Okay? The cool thing about functional medicine is if you take care of the big things, the anemia patterns, the blood sugar, the hormones, the vitamins, a lot of the little stuff goes away. Now, what is the exact mechanism? I don't know. Does it really matter? Okay? Do we know that exact hormone interacting with this pathway to correct this problem? No. The goal is to get people functioning better. Again, you don't have to. Medicine treats the symptoms. You got this, we're going to go take care of this one little thing. Okay? But the thing is, if you take care of the big things, a lot of times all the little things take care of themselves. Because the body's able to what? Function and heal the way it's supposed to. Number 5. Got to fix your gut. Who in here knows what leaky gut is? Anybody?
I doubt that I have it.
Huh?
How we know that we have a
Testing. Okay? Now, leaky gut. If you have, listen, if you're autoimmune, high probability you got it.
Yeah.
Right. So here's what it is. Your digestive tract, when you eat food, you digest these food, and they turn into proteins, and these proteins go into your bloodstream. Right? Now these is the inside of your intestines. They're called tight junction cells. They're like filters. Proteins are supposed to pass through there into the bloodstream. So who in here has had everybody's had broccoli, right? Remember the little nub on the end of the broccoli? The little part of the flour there, whatever it is? That, for example purposes, that's supposed to pass through, but the whole stalk isn't supposed to get in there. But when this system breaks down, when your gut breaks down, because the immune system actually breaks it down, you get the whole stalk in there, and 80% of your immune system surrounds your digestive tract because it's continually polluted by what we eat and drink. You get a systemic windup. Your immune system goes crazy because there's huge proteins not supposed to be in here, and everything goes crazy, and when the immune system goes crazy, you lose thyroid tissue. It's like the cat. You stimulate the cat goes crazy, the entire body's immune system goes crazy, you lose thyroid tissue. So the whole goal is immune system modulation. You got to keep the immune system calm.
The library will be closing at 9 o'clock. If you have any items to check out, please bring them to the circulation desk at this time. In addition, all printing will be completing by 8:50. Thank you.
All right, again, so the goal is immune system modulation, heal the gut, okay? Number 6. You got leaky gut, you got leaky brain. Who in here has cognitive issues? Can't think? Brain cloudiness, can't remember stuff properly, memory not as good as it is? Huh? Yes? Okay. What is that? Your body has what's called the blood-brain barrier. Your brain sits in a privileged position. It's protected by this membrane. Only certain things can get in there. Well, when that filtering mechanism, that barrier system breaks down, it lets stuff in that's not supposed to get in there. And what happens is your brain's immune system, called microglial cells, they get stirred up because they're trying to protect your brain, and we get what's called brain on fire. And you have problems thinking. So you gotta fix your brain as well as your gut. Remember we talked about how brain conditions? See, here's the thing. All this stuff has to be fixed. You can't fix one if you want to get better. You gotta fix all this stuff. You gotta proper stress management. I don't care what it is. Stress influences brain function. I don't care what it is. Meditation, yoga, knitting, gardening. Too cold. Huh?
Shopping.
I said
Well, I don't know if you can afford to shop, if that's good for you.
Coffee.
Until the bill comes, right? And then it's not so. Then it's not so
Another
stressful.
stress is coming.
Exactly. You got to have a stress management program in place. And 8, and most importantly of all these keys, is stop the insane thinking. Now, what does that mean? All right. People ask me what conditions I take care of. The answer is everything. I specialize in not specializing. Because here's the thing. I don't care what the name is. I want to know what. Why? If you can't control your blood sugar, there's a reason why. If you can't go to the bathroom, there's a reason why. If you can't sleep at night, there's a reason why. If you can't lose weight, there's a reason why. And the thing is, remember those 8 things? If we can get in there and look around and figure out which of those, and maybe some more, and work on those, then a lot of these things get better. So the answer is anything. Most conditions have diabetes and thyroid and all this other stuff have a lot of similarities in the entire thing. So you work on one, all the other stuff gets better. People ask me, what does it take to fix or help manage autoimmune thyroid? That's it. Okay? Is it vitamins? Is it gut? Is it inflammation? Is it immune system? Is it hormones? Is it anemia patterns, all the stuff I told you before. It's not as simple as PSH, take some Thyroid, right? If you want to correct the cause. All right, so can you predict the future? Yes. Number one, order the correct test. Number two, you got to check the underlying cause. Number three, focus on the cause, not the symptoms. Number four, correct the dysfunction, not alter the labs with drugs. Everybody who's on medication, when you go for a blood test, your labs are sometimes significantly altered because of the medication you're taking. So how do you know where you are? Okay? If you're taking hormone, your TSH is going to be suppressed because you're taking it. You got to address the body as a whole. You got to have a systematic approach, and most importantly, my opinion is mentoring. Listen, I play golf a couple times a year. I'm really bad at golf. Really bad. Bring a lot of balls when I play. Now, practice doesn't make perfect. Perfect practice makes perfect. Because if I practice a slice, right to the right, to the right, to the right. So I've gotten really good at that. Now, if I wanted to get better at playing golf, I'd have to hire somebody to show me what to do. You're not keeping your head down. You're not bringing your hips through, whatever it is. Okay? A lot of times, again, it's very difficult for me to figure this out on my own would be almost impossible. Okay? So, question. If your health was failing, what would you like to know? What would you like to know? Things are going wrong, what would you like to know? Today or 5 years from now?
Now.
Right, you'd like to know now. Okay?
Yes.
If your house was filling with water, when would you like to do something about it?
Now.
Right? We'll wait for a week. Let's let it run for a week, flood the street. Let me tell you, I'm almost done. Let me tell you about my sister-in-law. What time is it?
I don't know.
8:37.
Okay. All right. Let me tell you about my sister-in-law. Donna. Okay? She had a year and a half, she had a stroke. Okay? Year and a half ago, she had a stroke. She was uncontrolled diabetes and uncontrolled hypertension. She felt fine the second before the stroke. Okay? Now, she's made a full recovery. She's no longer diabetic. She's lost almost 100 pounds. She's off all her medications. The reason I tell you that is not to impress you, but to impress upon you what's possible when you deal with the cause. Okay? You can't wait until you feel bad to do something about it. Right. You got to look around. Because you know why? Transformation begins. Listen, knowledge is not equal power. Knowledge plus what?
Action.
You got to do something. Okay? If you don't do something tonight, you're wasting this hour and a half. Right? There's three types of people. There's the victim. Okay? You ever know that somebody's become their disease? Okay? I'm a diabetic, or I got this, or I got that. How does it usually end up for these people? Not so good. Okay? There's a river person, and this is where most people, they go along, they do the best they can, they eat well, they exercise, they try, but they're just sort of sucked along by life until what? Wham, something hits them. Then they're forced to move into action. Okay? That's where most people are. And there's only a few of these. There's a proactive person. The person who doesn't wait for the wham to happen, who looks around and says, you know what, I'm going to be proactive. I'm going to look to make sure that I'm doing everything I possibly can to avoid something. Which one of these are you? Because listen, train's coming. You're getting off the tracks, you're going to let it hit you. I don't know. I got a gift for everybody here. There's a catch. Here's the catch. Number one, you got to be willing to change. Okay? If you're not willing to change, can't help you. Okay? Number two, we can only help a few people a month. I'm too busy. And number three, we only take A students and B students, not C students. Now, what's an A student? An A student is somebody who's perfect. Okay? Tell them what to do, they follow to a T. You only get, there's very few of those. A B student is somebody who says, you know what? I realize I'm going to slip and fall. I'm willing to get back up, I'm willing to keep fighting. That's a B student. And a C student is, I don't know if this is the right time, it's too cold out for me to do this, why don't we wait till later? Okay. That doesn't work out. Okay. Hello again, this is Dr. Robert White, and I want to thank you for watching our workshop on the unresolved thyroid. Many of you agree with our approach to thyroid conditions and are looking to take the next step in regaining your health. So what is the next step? Before I tell you, I need to ask you a few questions because as much as people need our help, not everybody is ready to be helped. First, question number one, are you really serious about your health? And question number two, are you willing to make changes to support your health if need be? If you answered yes to both of those questions, then the next step is either contact us via email or call the office to schedule a consultation where we can discuss your history in detail and then make some recommendations. You can either call the office directly at 973-376-8383, or you can email us at bob@advancedintegratedhealth.com. Either way, I look forward to meeting you and helping you in the very near future. Take care.